Hi, everyone. I'm Dr. Lisa Palmer, Dr. Mama Bear, coming to you live from Central Florida. Let me know if you guys can hear me. I'd love for you guys to join me on crazy, curious cases or curious, crazy cases that we work on in the office, that we work on at Palmer Natural Health, located here in Central Florida, that we have clients from all different places in the country, clients all over the world, and we're like little health detectives, right? So let me know if you guys are out there. Let me know if you can hear me. It is Quantum Nutrition Testing's 1 year anniversary, which is really, really awesome. Some of you guys know we do a technology at our office and teach a technology called quantum nutrition testing. It is very, very cool. I actually was just training practitioners in the academy, and we have our first engineer. I believe he said he was electrical. Let me see. He is environmental engineer. An environmental engineer in the academy. We have lots of different people that really find an interest in not only natural health care, but also helping people naturally. It is very, very, very cool to see. Hey, Keely, it is a full moon. Yes, supposedly my calendar says Thursday is the full moon, but Keely, I think you're right. I think it's going to happen sooner, and it is curious. It's a curious thing. We just had our garden party, and we had Alice from Alice in Wonderland. She was there, and she's like, doesn't she have a line about it's so curious? So curious. I agree with her. It's a curious planet that we're on, and weird things happen, right? Weird cases. We get a lot of curious cases. We get cases where they've been to their medical doctor. Medical doctor's not quite sure what's going on. They may give the patient antibiotics. They may give the patient steroids. They may give the patient injections of antibiotics or injections of steroids. They're curious. They're curious. They can't quite put their finger on the cause. And then that leads to the next level of doctors, the specialists, right? So then the specialists in that organ system. Now, what's crazy is organs don't like they work together. Your body works together. The physiological systems of the body work together. And so it's a little confusing in American medicine. And I think it goes into other countries as well when you have a physician that focuses on one part, right? They're a specialist, they're a cardiologist, they're a specialist in the heart, they're a pulmonologist, they're specialists in the lungs, they are gastroenterologists, they're a specialist in the digestive tract. And so the problem is not you're just not a heart and you're just not a digestive tract and you're just not an eye. And so other systems can have an effect on other systems. The next layer, if your general practitioner can't figure out what's going on with you, or they're stumped or they're curious, they send you to the specialist that runs tests. The test could be blood work. It could be a urine analysis where they look at your urine. They can look at your feces, your poop. And they can run imaging, right? So they can take pictures, they can take x-rays of your bones, meant to look at bone. They can use magnetic resonance imaging, which is magnets, MRI, where it's meant to look more at soft tissue. They can do CT scans, which is also meant to look at bone, but at a different level than an x-ray. And they're they're taking pictures to see if they can figure out what's going on inside. They can use ultrasound, which is sound waves, and really they're looking at shadows and pictures to try to figure out what the heck is happening. What is the cause? What is going on with this patient that is causing these symptoms? What's going on in this lab that's causing potential symptoms? Then your symptoms could be like you feel tired. You might feel depressed. No one ever has come into the office with chronic problems and says, I feel amazing. I'm happy. I feel like poop. Like no one says that, right? So most people, if they don't feel well, they're depressed. You're not happy you don't feel well. You're frustrated that you used to be able to ride your bike and you can't. You used to be able to clean your house and you can't. You used to be able to hang out with your friends and you're too anxious. You used to be able to exercise at the gym and you don't have the energy. You used to be able to do these things and you can't do them. If there's things you used to do and your health does not allow you to do them, you are not healthy, right? It is not the aging process. Yes, We have wear and tear on the body, but just because someone ages does not mean they shouldn't be able to walk, run, dance, do whatever they enjoy doing. And so when these curious cases cannot get figured out, when these curious cases stump the specialist, then these people end up in places like Mayo Clinic or Cleveland Clinic or the university in their areas, medical school. They end up there, and what is done there, right? They're again looking to try to figure it out. And unfortunately, there's technology that is limited, right? The technology only gives you so many answers, and when the technology can't give you the answers, these cases go, they tell them that they're crazy. They tell them it's in their head. They tell them that they made it up. They tell them they're hallucinating, right? Too many patients have come to me and they're like, I went to this doctor and I went to this specialist and I went to this special hospital and I went to all these different places, and no doctor can figure out what's wrong with me. So they gave me antidepressants and they said that I was crazy. No, you're not crazy. When you have something wrong with you, you're not going to feel good. When you have something wrong with you, there's a cause to that. And with quantum nutrition testing, which is the technology we do at our office, and practitioners all over the United States are learning it as well, we look for the cause of problems. We look for the underlying sneaky stuff that lab tests miss, that imaging isn't sure what it is if they see it, that they're not quite sure how to handle. One of those crazy curious cases is parasitic, right? Parasites are real. Parasites exist. Parasites are so easy to have too many of them. They're so easy to overlook because they're very challenging to find. If you were to do a blood study, you have all this blood circulating through your system, and say they prick your finger and they stick it under a slide. What's the likelihood of a raindrop, not even a whole raindrop, a tiny half a raindrop under a slide when you have way more pints of blood than that, right? Um, what is the likelihood that that one little drop of blood is going to show that tech something that they can call a parasite? Say they take more blood and they might do a couple slides. What's the likelihood that they're going to find something? And what if the parasite's not bloodborne? Meaning, what if the parasite doesn't go in the blood? What if the parasite lives in the digestive tract? What if the parasite's living in your eye as a floater, right? You like look around and you're like, what is that floating thing? And your eye doctor's like, it's a floater. Don't worry about it. Yeah, but doc, what is a floater? Like, what is that, right? So there are parasites. There's different types of smaller parasites that live in the eye. And if you look just right, you might see something that's a floater, right? If they don't find anything in the blood, then they can look at your stool. Now, if the parasites are not being actively killed or they don't lay eggs that get into the digestive tract, are you going to find it in the stool? And then, not to be disgusting, but if my pen represents a stool sample, right? The lab tech's going to take a swipe of it. They're going to stick it under the slide and they're looking for eggs. They're looking for parasites, looking for that. Well, what if there's no parasites in here because it's not coming out in the stool? Or what if it came out in the stool, but it's so big that they can't stick it on the slide? Or it came out over here, but they swiped over here, right? They took the sample over here. It's going to get missed. They can check. So they can check the blood, they can check the feces, they can check with imaging, right? Sometimes parasites will show up as lesions. But for whatever reason, American doctors don't always, I should change that, rarely will acknowledge a lesion linked to a parasite. And then the handling of it is there is a deficit in training on how to handle that. The difference between quantum nutrition testing, which is what we do, and these other procedures is we're matching frequencies. We're matching the frequency or the pattern of a bug with the pattern of what's in the body. And when you match the frequencies, we get a response, right? We get a response that says, yes, this frequency seems to resonate, seems to appear in this person. I had a mom reach out to me. I guess the case, there was a little girl had diarrhea and vomiting, and for whatever reason, I don't know. I guess I'll find out very soon, this week or next week, the mom didn't start care for her kid. I begged, I pleaded. That's the hardest thing when you really care about people. It's the hardest thing when you know you can help someone, and for whatever reason they don't let you. Someone's having a hard time, you extend your hand like, "I'll help you," and they knock it away. That is really, really, really tough, especially if it's family or friends. That's tough as practitioners. So, as I train new practitioners, I'm like, look, natural healthcare is super cool. Cracking cases that are crazy and mysterious, and where other practitioners may have had difficulty in figuring it out and helping the person, so rewarding and so cool. But the flip side of that, that's not cool and not rewarding, is when you really, really want to help someone. You want to help a friend, or you want to help a family member, or you want to help a neighbor, or you even want to help a patient, and they won't let you. They won't let you. And what's so frustrating is, I think the case that waited to let me help them the longest was, one of my patients been with me since pretty much day one. Been a patient of mine like 15 years, doing amazing. She's on what we call wellness, meaning I just check in with her, make sure everything's working well, do some preventative work, make sure that she's got strong cognition, she's got great memory. She's in her 70s. Her cardiovascular system's working well. So we're doing wellness hacking, or boosting at this point, prevention at this point. Then I see her, once every 6 months or so, unless something were to occur, and we handled it. So she told a friend that he needed to come see me 7 years ago. 7 years ago. Now it's been a little bit longer than that because I've had him for about 2 years now. So 9 years ago, she told him, "You need to go see Dr. Palmer." And it was interesting because the side of his face, so the left side of his face, let me see. The left side of his face was like his cheek was really puffy, and the right side of his face was fine. And he went to different docs, and no one could figure out what the heck was happening, right? He also had daily hiccups, right? So this is a crazy, curious case. Like, and I don't mean like you drink some water and got hiccups. I mean, he had hiccups all day long and all night long. I can't even imagine. Can you imagine hiccuping all night long? Like, how horrible. And using technology that we didn't have quantum back then, but using nutritional technology, determined that he actually had mold in his face. It turns out just recently we found out that the house next to him had severe mold problems. Every time that family showered, their bathroom and hallway would flood. Now, if you take a shower and your bathroom and your hallway floods, that's a really bad sign. And not only did it flood for a year, it flooded for decades. They just, I don't know. I guess they thought that was normal. I guess they thought, hey, when someone showers, we're going to have to shop back up all this water or whatever. But you can't have that much moisture in your house. Most people, I would assume, use their showers daily. And I can't imagine the amount of mold levels in there. My patient mentioned that the lady that owned that house that told them about the flooding, she passed, and then her kids moved in there, and they are all very sick. And finally, they took that house down to the studs. But when they did, you could see the black mold throughout the house. And just that house being under construction bothered my patient. And so his face tested for mold. And as we use very specific products to help his body remove the mold, if you were to look at him today, his face is symmetrical. The left side isn't swollen out anymore. And he doesn't have those crazy, uh, aggravating hiccups where he hiccuped for days and days and days on end. Really, really interesting case, but it took him 9 years. Well, it took him 7 years when I first met him, 7 years of one of my other patients telling him, "You need to go see Dr. Palmer." I'm like, well done. Then I'm still in practice, and well done. I'm still seeing patients. You know what I mean? Like, it's a long time to wait. So I encourage you guys, don't wait. If you have something that's driving you crazy, if you have something that is nagging, if you have something that is non-optimal, right? So symptoms mean something is not right. You should not have symptoms. There's no such thing as a normal headache. There's no such thing as your normal horrible bleed to death cramps. There's no such thing as your normal rash. You can't put the word normal. Normal means normal can have two definitions. There's one definition of normal that means common, right? It's normal because it's common. PMS is not normal. PMS stands for premenstrual syndrome. It's not normal. You're not supposed to have that, right? In health, when we talk about normal, we talk about healthy function, but unfortunately, people don't use that word normal in a healthy definition way. And then even the word healthy is also not used properly, right? So I have a new patient come in, they're like, I'm healthy. And I'm like, oh, okay, tell me about it. They're like, well, I get migraines and I have headaches and I have explosive diarrhea but I'm healthy. What do you mean you're not dying? Is that the definition of healthy now? Is not dying? Like you can sit there and not die? Is that your definition of healthy? Or I eat healthy. And I'm like, okay, tell me about it. Oh, I wake up and I have Chick-fil-A for breakfast. And then for lunch, I'll have Chipotle. And then for dinner, I'll get Uber Eats. And, I'll have French fries and I'll have this and I drink diet soda and whatever. And I'm like, that's your definition of healthy? These definitions have definitely been altered. They have been compromised. They have been changed in our society to mean things that they're not supposed to mean. That's not healthy, right? That's that person's definition of healthy. And maybe that means they don't eat candy for breakfast, right? We just met a patient, they had cookies for their breakfast was cookies. And so, you know, is that your definition? You had some protein, so that's healthy, and that person eats cookies, so that's not healthy? I don't know. I don't know. Hi, Tati. Hi, Kaylee. Hi, Jonathan. Hey, Mary. So these crazy cases, if something is unknown, if someone's having an issue and no one can figure it out, if you don't feel good, if your kid gets angry all of a sudden, or gets aggressive, or is diagnosed with ADD or ADHD or some other kind of crazy diagnosis, there's a cause to that. And medication will never ever fix it. Medication always comes with a price. Medication always has side effects. Doesn't sometimes have side effects. And a side effect doesn't mean you take it and you die. A side effect means there's the effect of the medication. And off that medication, there's side things that are going to happen. All medications need to be processed in the liver. Pharmaceutical companies will add different things so the medication bypasses the liver, right? But your liver is a big filter. And so these medications can have chemicals, they can have heavy metals. Those chemicals and metals cause damage to the liver. That's why there's certain medications where the doctor will check your liver function every so many months. Why is the doctor checking your liver function? The doctor's checking your liver function because they can't let your liver shut down and die, because then you die. The medication's so toxic, they have to keep an eye on your liver so you don't die. Like, that's crazy. Or they have to keep an eye on your kidneys so your kidneys don't die. I had a case probably 10 years ago. She had heart problems and she had kidney problems. And her heart medication caused the kidney problems, and the kidney medication made the heart worse. So the heart doctor is telling her to stop taking the kidney medication. The kidney doctor is telling her to stop taking or reduce the heart medication. So what do? She was stuck in this horrible situation. And unfortunately, she waited way too long to come see me, right? We will help every case that we can. But there's times where you wait a little too long, right? So the gentleman I was telling you waited 7 years. Luckily, we could still help him. It's kind of like a roof leak, right? You have a hole in your roof. It's a little tiny hole, and you have maybe like water dripping down the wall, and it's a little tiny leak, right? If you handle it, you get the new roof or you do whatever, then good. You have less damage on the inside. But if you have a huge hole in your roof and it's like raining inside your house, you're going to have a lot more damage. And if you keep it like that, what's going to happen, whether it's the little leak or the big leak, it's going to get worse and worse and worse and worse. And then there's going to be other problems. So if we're using the roof leak as an example, you have water dripping down your wall, you're going to get mold growth in the wall. Then it's going to drip down into your flooring. So if you have tile, if it gets underneath the tile, you might have black mold under the tile. If you have carpeting, it may get under the carpeting, have black mold in the carpeting, you have mold in the wall, you have spores in the air. I mean, that's bad news. One of the other curious cases that we work on is mold illness. Here in Florida, Some people in the last hurricane lost their houses to water damage. There was flooding. Central Florida has a lot of rivers. Central Florida has a lot of lakes. Florida's a peninsula. We have water on all three sides of our state, right? And mold illness goes undiagnosed. These people are suffering. They have difficulty with concentration. They get very puffy looking. They get puffy. They have hormonal issues because mold increases estrogen. And what will happen with increased estrogen is your hormones will be imbalanced. Increased estrogen is known to increase rates, cause increased rates of cancer, right? And so mold illness goes unrecognized. The person just knows they don't feel good, and then it's difficult to find why. It's difficult to find the cause. So Marissa says, "Hi, Dr. Palmer. Hope you're well. I have a question about pilomatricoma. A friend's 4-year-old has 3 spots removed and going to get a 4th out next week. I say, what's the root cause?" Yeah. So I would want to know, omas are the word oma means tumor or mass. The pilo is hair, and matri, I'm not sure. So I don't know what that full word means, but it does mean tumor in the hair. The matri part, I have to look that up. Maybe the hair follicle, I don't know. But basically, it's a big, long, fancy word saying there's a tumor or growth in this kid's skin, and they don't know why. So when in doubt, a lot of docs will cut it out. I'm not saying that's wrong, but I would want to know why it's there. If you have a problem and you cut out the problem, but you didn't find the cause, oftentimes that stuff grows back. I would want to know, what's the cause. Is it mold? Is it parasitic? Is there a chemical? What is happening, right? Something caused that. And I'm totally agree with you, Marissa. I want to know what is the cause? What is the root cause? What caused that kid's body, that little 4-year-old's body, to do that? What was the cause? It didn't just do it for fun. There was something that aggravated the system. The system responded, and there you go. So something caused that. I would want to know through quantum nutrition testing. I would want to know, is it mold? Is it chemicals? Is it parasites? Is it what is the cause? Jonathan's reminding me to talk about the full moon for Thursday. Thursday is a full moon. People are known to have increased behavioral changes. Teachers will tell you, yeah, full moon, kids are acting crazy. Emergency room personnel will tell you, oh my gosh, it's a full moon, we're getting more cases. Why? Why is that the case? That's the case because our bodies respond to what's happening on our planet, right? Our bodies, I thought, my first degree's in sports medicine. I'm like, astronomy's stupid. Like, why do I care what planets and stars are doing? And what a very small perspective I had at that point, right? At that point in my life, in my 20s, I wanted to work with professional athletes. I was working with Division I college athletes. I was working with Super League rugby athletes. I was working with NAIA athletes. I was working professional women's soccer. I was working men's semi-pro soccer. I was working professional men's indoor. That was what my life was. So it was like planets and stars. That's for other people. Like, what do we need to stop? I'm not going to be an astronaut. What do I care, right? That was my viewpoint. Well, it turns out that the lunar cycle has an effect on our body. We know it has an effect on tides, right? Our body is made out of what? We're 98% water. And so if the moon can have an effect on our ocean tides, do you think the moon can have an effect on us? Do you think the moon can have an effect on the bugs that live in us, right? We're more bug than human, right? We have bacteria, we have parasites, we have other stuff. And if your microbiome, or the internal environment of your body, is healthy, you have healthy, in the true sense, physiology. You have healthy function. If your bugs are imbalanced, you have symptoms, right? And so if those bugs are parasitic, you might have bloating. You might have constipation. You might have nausea, vomiting. Your family may be more emotional, more aggressive, more irritable, right? And so with quantum nutrition testing, we're looking to see, does the person have the frequency of parasites? And if they do, then what do we use to handle that? What kind of herbs, so this is Bohr, what kind of herbs can you use to help handle that and help rebalance the body. This board does not taste good, right? I have to stop doing that while I'm live with you guys. But it has stuff like sweet wormwood. We have plants on our planet that have the capabilities to help rebalance the body. We'll use that word. And this product has a lot of different herbs that are very, very powerful and help to rebalance the body. Marissa says, yes, hair follicles. Okay, good. So my medical terminology class is paid off. Marissa's going to test her. Cool. Yeah, you're so welcome. So if you have a health challenge, if you have a health challenge, then ask us to help. Private message me on my Palmer Natural Health Facebook page, or private message me on my personal page, or whatever you guys are on, and ask for help. Call us tomorrow, 407-682-8444. Call us and ask for help. It's okay to ask for help. If you don't feel good, we have to find out why. Kristen says, skin tag practitioner had me on amoeba cord before pregnancy, so assume it's parasitic, never did decrease in size. Is there a way to actually disappear, or is it okay to get it removed by the dermatologist? So skin tags sometimes are linked to blood sugar issues. So I would be curious to see if there is problems with high blood sugar or problems with low blood sugar. Sometimes people with high stress levels, it will negatively affect the pancreas. And the pancreas will have difficulty balancing blood sugar levels, right? So with Quantum, we figure out what the heck is the cause of the skin tag, the mole, the plantar wart, the rash, the eczema, the big long name that they just asked me about. We look for the cause, and if we can find the cause and then find the exact right herb, the exact right supplementation, the exact right carbon technology to balance it out, then the body heals. I had this mole skin tag. I don't even know what the heck it was. I don't even know why you're telling the story, because it's slightly embarrassing, but I'm kind of over that these days. And we were at the beach. I was in a bikini, and I rubbed my leg, and I was like, what the heck is that? And this thing, we were in the room, we were staying in a hotel. So when we left the beach, washed the sand off, went up to the room, and I rubbed like my bikini line because it felt like there was a shell or something. So I rubbed the side of my leg, and this black thing came out. I'm like, what the heck is this? And it turns out I thought I had a mole or ingrown hair or something. And it turns out this thing had, like, I'm not even kidding, it was like 1 inch long. And so when the body gets what it needs to heal, we've seen warts fall off. We've seen eczema clear up. We've seen skin tags fall off. We've seen interesting things happen when the body can rebalance itself. Jessica says she rubs para-3 on skin tags. Yeah, so you can do that. We would want to find out what the heck is the cause and then see what can be done to rebalance the body. And when you rebalance the body, these difficult cases get better. When you rebalance the body, people that were told they're crazy and it's all in their head, those people get better. They feel better. They have less anxiety. They have less depression. They have less fear. I would venture to say that their well-being, both physically and mentally and emotionally, improves. Why? When you feel better, I've been hearing this a lot. People are like, when you feel better, you do better. I'm like, yeah, that's true. But when you're healthy, you will feel good, right? When your body's not working right, you're gonna feel like hell, right? Like you don't feel good, right? Yeah. So you're not gonna feel good. If you don't feel good because you're sick to your stomach or you're nauseous. As a kid, I was nauseous a lot. I didn't know the word nauseous. So all I could describe to my mom was I didn't like breakfast because the nausea was worse in the morning. And she's like, why aren't you eating? And I'm like, that saggy bowl or soggy bowl of Cheerios, saggy or soggy, I guess it works. It doesn't look good to me. And I'm not hungry in the morning. And she's like, oh, you're not a morning person, right? Well, it turns out when, later in my career, when I really started studying holistic nutrition and I really started studying parasites, and after 9 years of college and being in chiropractic school, I never stopped learning. I learn every day, right? And I really dug deep into the parasite world because it is not really talked about in this country. And finally, I started handling my own parasites. And I'm like, oh my goodness, for the first time in my life. So it wasn't until my late 20s. So almost 3 decades, right? For the first time in my life, because even as an infant, I had awful colic, like screaming, awful, awful colic. Part of it was that because my pediatrician told my parents to feed me soy formula. Soy is really hard to break down and causes gas, right? And so no wonder as an infant I had colic. And so for, finally I'm in my late 20s, early 30s, and for the first time in my life, I'm not nauseous in the morning. And I'm like, oh my gosh, is how you're supposed to feel? Is this normal? You wake up and your stomach's not bloated. You wake up and you actually can eat something and not be nauseous. You wake up and have an appetite. You wake up and don't feel like you're gonna throw up. Like, wow, that's amazing. I wonder how many people labeled anorexic or labeled bulimic are not anorexic. Remember, all these terms are just set of symptoms given a name, right? So bulimia is a set of symptoms where you eat a lot of food, which parasites can make you want to eat a lot of food, but then you do that and you feel nauseous and a bulimic will throw up. So they call it like a mental health problem. No, there's a cause to that, right? And if it's parasitic, yeah, parasites make you eat. Like they make you eat more than you should, and then you get nauseous, and then you throw up. I'm not minimizing anorexia. I'm not minimizing bulimia. I'm not minimizing any of that. But it's very, very interesting that a lot of my parasitic cases that are um, very, very skinny, if they were put in front of a certain type of practitioner, they might be labeled as anorexic, right? We've turned around many cases where, I'm thinking of a young man right now who we did a workup on, and he's working with us, and he's doing much better. But when he first came in, he looked like, I'm not being mean, I'm just giving you a description. He looked like a walking skeleton. And the tricky part of these cases is that if it is parasitic, oftentimes a case like that will actually lose more weight before they get better. I tell them straight away, if there's the frequency of parasites and the person's already really skinny, I will tell them, look, I know you're really skinny. I know you feel like a walking skeleton. I know you don't like the way that you look. I know you don't like the way that you feel. But if I'm finding parasitic action here, I have to tell you, I'm very upfront. I have to tell you, it is extremely possible that you're going to lose more weight before this reverses. And your friends and your family are going to freak out, and you're going to freak out too. But if we push through this, it is my goal you go through it and we handle it, and you no longer a walking skeleton. You actually will survive and not be pale and anemic and so skinny that your bones are showing, right? And so we've turned these cases around. We've turned these cases around where the person's nauseous, where they're bloated, where they have IBS, where they have Crohn's. And it's not that I'm treating these conditions. We're looking at balancing out the body so then the body can do what it was meant to do. The body was created to heal. You just have to figure out if there's things in the way for preventing it from healing. All right. So hopefully that helps you guys. I hope you have a great week. If you are working on parasites, Thursday is a full moon, so work with your practitioner. You may need to increase your doses. Follow your practitioner's instructions on that. And if you consider yourself a crazy case or a curious case or a mysterious case, I guess I could have done that as well today with today's title, then please reach out. I'd love to help you. I'm Dr. Lisa Palmer, Dr. Mama Bear. Good night, everyone.